In a residential care setting, this can include neglect through lack of food and water.
Don't you want your dinner, Molly?
I'm not hungry.
Very well, suit yourself.
Appropriate clothing, hygiene, and lack of mental stimulation or lack of assistance to move around, either in bed or moving around the unit.
She's been going downhill more and more. It's a mystery.
Neglect can also mean the denial or delay of medical care.
Would you recommend a change to medication or her care plan?
Look, at her age, dear, there's nothing to be done. It's a long list. Let's keep moving.
Marita, I want to go to the toilet.
Let me look after bed.
It can also include lack of access to the toilet or inadequate changing of pads or disposable pants, which can lead to bed sores.
What big one?
Are you sure?
Not changing bedclothes after a resident has wet the bed. Just allowing the wet bed linen to dry or sprinkling it with talcum powder is neglect. Signs of neglect: deterioration in appearance or personal hygiene, unhygienic or unsafe environment, rashes, sores, ulcers, unexplained weight loss and inadequate food or drink, inadequate medical care, lack of social stimulation. The presence of pressure sores may also be a sign of abuse through neglect.
Claire, could you give me a hand to read this? I can't seem to find my glasses anywhere.
Not now, Dominic, I'm busy.
Abuse by acts of omission. Abuse by acts of omission is a lack of basic emotional support and respect. This can involve not attending to the older person, ignoring moans, calls for help, or call bells. Failure to provide necessary psychological care such as therapy or medication for depression, isolation of the older person, leaving them alone, or restrictions on phone calls or visitors. Lack of assistance in doing interesting activities such as watching preferred TV programmes or intellectual activities.
Let's watch football. You'll like it.
Some overlap exists between abuse by neglect and abuse by acts of omission. Regardless, they are both forms of elder abuse. Abuse by discrimination. Excluding the older person by speaking in a language they don't understand is a form of discrimination.
Oui? Oui? Or just go on the bed. You'll be fine. Ça va bien? Ça va très bien? Oui, fine.
Shouting at an older person who has poor communication skills is also a form of discrimination.
I hate putting that guy Ephraim to bed. But to be honest, I don't really like working with blacks in general.
Older people, like anyone else, can also experience abuse by discrimination which focuses on their ethnic or cultural background, religion, political persuasion, gender or sexual orientation, disability or age. Staff can exhibit ageist attitudes in the way that they approach the care of older people. Ageist practices and attitudes can occur in working relationships with older people and can be characterised by lack of consultation, patronising behaviour and insensitive responses to the needs and wishes of an older person.
Scrambled eggs.
We all have a duty to recognise older people as individuals with different life histories, needs and expectations.
Hey everybody, let's say a decade of the Rosary. The first glorious mystery of the resurrection.
It is appropriate to cater to individuals' religious and spiritual needs. However, staff must avoid imposing their own cultural, religious or political beliefs onto the older person who may not share those beliefs. All residents should be individually consulted about their beliefs and cultural preferences.
Gonna say please and thank you, Joe? Any chance of that now? Right. There you go, Liam. Oh my God.
Can I have some?
Hang on.
Can I get some? Can I have some, please?
The nature of this abuse often means that older victims of discrimination find it difficult to come forward, as they have no way of knowing whether they will be listened to or supported in a sensitive way.
Come on, Joe, come on. Stay in the bed for a couple of hours, Joe. Your breakfast will be at 8 o'clock.
Institutional abuse.
Are you finished yet, Molly?
No, no.
Okay, hurry up.
Close the door.
The types of abuse perpetrated in residential care settings are those we have described in the programme. But there may be more at issue than the behaviour of a particular individual because of the organisational nature of the delivery of care.
Did you shave, Joe? Well, yes or no? Yeah, okay.
Will you check their pads if they are dry, and I will do the extra.
Okay.
Abuse may occur because of poor facilities, inappropriate work practices, inadequate systems, poor record keeping, training, monitoring, or because of poor financial control around residents' personal allowances. Sometimes abuse occurs because staff are under pressure to perform a task or tasks in a given time.
Oh, that's Joe in room 6. I'll go see
Oh,
him.
relax, love. Finish your coffee. Joe is always ringing. He's just looking for attention. He's fine.
But in my training course, we were always taught to respond to calls immediately. Isn't that good practice?
Very is something you have to adapt. We can't be at their beck and call the whole time.
And another thing, why do we get the clients up and dressed at 6:30 in the morning? Most of them don't like it.
It works, just don't question it. You'll have to forget a lot of that theory. What works is best.
I don't know, it just seems like we should do more or something.
You need to get up now.
Sometimes those who care for older people are not suited to the requirements of the job, and they allow themselves to vent their impatience, frustration and anger on the older person whom they are supposed to be protecting and nurturing.
Can we not just bring them in separately? Why do we have to bring them in all together?
Because that's the way we do it here, love, okay?
In a residential care setting, staff may be prone to elder abuse because of poor work practices, lack of training, inadequate support and supervision, challenging working conditions, insufficient staffing, staff burnout. Sometimes neglect is not intentional. It may be the lack of adequate training about how to care for the older person.
Hurry now, Lee.
Claire, I want to go
Hang on,
to
I need to answer a call now.
Factors that may lead to abuse. Abuse occurs for many reasons, and the causes that lead people to abuse are not fully understood. However, the following risk factors have been identified. Individuals who are unsuitable for a caring role,
Have to do something. Get up.
do not like working with older people,
Watch TV or something. It goes like this every
have a
day.
lack of understanding of the needs of older people,
Get up, get up.
are experiencing personal stress, such as relationship difficulties or alcohol or drug problems.
Joe! Joe! What are you doing?
A range of other factors may increase the likelihood of abuse happening. For example, providing care for those with complex needs such as When the older person has a form of dementia which may affect their memory or ability to reason and causes unpredictable behaviour. Has communication problems as a result of hearing, visual or speech difficulties. Has behaviour problems or major changes in personality which result in repetitive behaviour, wandering or aggression. Demands or needs more care than the carer can give.
What you call that other one? She caught me by the arm. You
Calm
all
down,
saw it,
Liam.
didn't you?
Calm down,
You saw
Liam.
what happened.
Often abuse happens simply because there is no impediment to stop it.
Get up, go and do something. You're lying all day. Get up, do something. Get up, get up.
Treating older people with dignity and respect. In a residential care setting, it is important that staff manage the care of older people with dignity and respect. Treating older people with dignity and respect can help avoid instances of abuse. While banter and chat between residents and staff is a good thing, staff should not become overly familiar and use pet names inappropriately. Teasing residents about their physical appearance, speech impediments or behaviour is unacceptable. Carers and staff should not normally have to wear gloves when caring for residents. Many older male residents will be unused to being cared for by females and may find it very distressing to be washed by a woman. Similarly, many older females will be very uncomfortable with a male attending them in the shower or taking them to the toilet. The sensitivities and preferences of older people should be respected.
I said a decade ago.
Older people who are terminally ill should be cared for with the utmost respect, and account should be taken of their beliefs.
You know, the angels are waiting for you.
Staff should be aware that residents will have different or no religious beliefs, and they should be treated with respect to their wishes.
I'll say another one tonight.
Staff should not fall into the trap of treating older people as children.
You'll be fine. Oh, poor little baby.
Demonstrations of comfort and support should be appropriate and acceptable to that individual. Staff should not patronise or think that all older people need assistance when eating or need to wear a bib. Many older residents look forward to meal times and should be allowed to enjoy it. They should not be rushed or fed if they can manage for themselves.
Let me enjoy it.
Hurry up, will you?
Staff should encourage residents to talk about their interests and family, and carers should show an interest in the older person's life experience.
Build a pond in my garden.
Right.
Managing disclosure.
This business of putting stuff.
If an older person begins to tell you that they are being abused, there are some key things to remember.
It's very distressing. I
so
can't
sorry.
begin to tell you what it's like. I find, like, they're so rough with you.
Do listen attentively and take notice of body language. Take it seriously, even if it is not making much sense to you at present. Try not to show you are shocked. Explain about confidentiality. Clarify the victim's version of the story, but do not ask leading questions. Reassure them that they have done the right thing in talking to you. Report it to your line manager.
They don't respect us at all. They take me.
Remember that you are there as a representative of your organisation, as well as a person with a duty of care. Remember, it is not your responsibility to handle the situation on your own.
You know what? It's terrible.
Don't take it lightly or make a joke about it.
And it's very distressing.
Dismiss or disbelieve what you have been told. Change the subject because you feel uncomfortable with it. Make assumptions. Don't say things like, "This can't be true. I don't believe it." That is ridiculous. What to do if you witness or suspect abuse.
To teach them how to behave.
Yeah.
Isn't that what it is?
We can talk here and you can tell me what's been upsetting you.
Yes, indeed. Well, it's been going on for some time now.
Take appropriate steps to ensure the safety of the older person.
You know,
follow your organisation's protection policy.
Don't fit me. You know,
Do not discuss the subject with or challenge the abuser.
Nearly frog marching.
Discuss the situation with your line manager or facility manager at the earliest opportunity.
And you watch other people.
Find out what the victim wants to do, but explain to them that you will need to inform your line manager. See the training manual that accompanies this DVD for further information.
Somebody sympathetic, you know.
I'm really glad you talked to me.
It's the cold hardness, I think, with them. That you don't get that feeling of the care.
What would you like me to do?
I'd like it to stop.
Okay.
Definitely. I think I've had enough of it.
Yeah.
Yeah.
It seems Claire has been doing this for some time. It's really shocking.
Do remember that acts of physical, sexual and financial abuse which violate laws against assault, rape, theft and other offences are criminal acts that must be reported to the Gardaí, who can investigate the matter further. If you believe that an older person is at risk from immediate harm, the Gardaí need to be informed immediately. Older people deserve to be treated with the respect that their lives and achievements as people warrant. For those reasons, it is crucial that all of us who work with older people maintain vigilance on the issue of abuse and be aware that we have a duty of care. If you witness elder abuse, doing nothing is not an option.